Good afternoon. I'm Dr. Cepeda. I'm the Chief Medical Officer of the Mobile County Health Department. Dr. Murphy's on assignment today. I know everybody will miss her, but I'll just fill in for her today. I'm sure she'll be back tomorrow. Going to update for our COVID counts for today. We have 3,300,227 388 cases in the United States, 135,295 deaths. In Alabama, today we have 54,768 cases and 1,096 deaths. In Mobile County today, we're reporting 5,110 cases, with 163 cases added yesterday, 143 added Saturday, and 145 added Friday. We ended the week of July 11th with 830 new cases. That is our highest so far to date. So if you get our daily COVID updates, you will notice something a little bit different right now. So given the rapidly evolving nature of this pandemic, we are modifying the manner of reporting of COVID-19 hospitalizations and deaths. So soon our data will be reported before contact investigations are complete, and will include deaths and hospitalizations of non-Mobile County residents in local hospitals. And this will result in an overall increase in the numbers that we're reporting, but it will be able to get out the numbers more accurately and more quickly, just in terms of what's in our local hospitals. And that way we can provide hopefully the most accurate and meaningful data in the most timely manner to have a clear understanding on the impact of COVID-19 in Mobile County. So today we have some questions from the media. Do we know about the large number of cases reported on Friday? So looking into those and seeing the sustained addition of cases today and Saturday, and the highest number that we've had so far with 830 for the week, it does appear to be a true and sustained increase in the number of COVID-19 cases occurring in our community. Another question is that it came out on the scanner that the hospitals in our area were on diversion. What does that mean? So we have seen a significant uptick in hospitalizations in our community, and that does increase the demand on the hospitals, but they have not exceeded capacity. So if you need to use any of our local hospitals for either for concern of COVID-19 or for any other needs, they're available to you. So other questions? How many ICU beds are there in Mobile County, and how many are in use now? So again, that's not a question that the health department can provide that information in terms of those specific numbers. They do change on a daily basis, but also we are, like I said, we are updating just our reporting of the hospitalizations. So we don't have a number. Normally we do report a number of patients who are hospitalized with COVID in our community, but we don't have that today. We may not have it for the next few days, just as we're updating our system of reporting. And you'll see that the Alabama Department of Public Health is actually changing this as well, because there just is not enough capacity in that system to go from the manual way that those have been done in the past. So we're trying to automate that, so it's a much more efficient system of reporting. So, and this says, I know another question, I know Ames data isn't released by the health department, but is there any quantifiable way to speak to what we have available in Mobile County given the recent increase in COVID hospitalizations? Again, that is a number. Availability changes all the time, because every day you have patients that are admitted and discharged, so that's a number that throughout the day it changes. It's not a static thing. It's very, very dynamic. But at this point, the hospitals do have capacity, and if they are on diversion, it means that they are moving things around to make their capacity better for handling everything. And if they're all on diversion, then they're all on equal ground and they can all take admissions. So there are still beds available in our local hospitals for COVID and all your other medical needs. Another question, there are more new cases now than there were when we had the shutdowns and stay-at-home orders. Is the reluctance to take those type of measures political, economic, or is there new medical and scientific information to suggest mask requirements are more effective that we know? So in terms of what we know is effective, it's really the same things that we know to be effective. Keeping a distance of at least 6 feet between you and other people, wearing a mask or a face covering, especially when you can't keep that distance, to decrease the spread of droplets and decrease the risk of transmission, and frequent hand washing or hand disinfection and cleaning of high-touch surfaces and trying to avoid touching your face. That's another thing that masks or face coverings do, is cut down on touching your face as a way to infect yourself. So the things that we know are beneficial are still beneficial, and that has not changed at all. Another question that got some information about a 2.5-year-old at a daycare that had been confirmed with the virus, and is this the youngest case that we've had in Mobile County? No, this is not the youngest. We've had 125 people in Mobile County who are between the ages of 0 and 4 who have been confirmed with infection with COVID-19, and several of these have been less than 12 months old. So some of them have been hospitalized and some of them have been outpatients in the community. All right, the next question. Election is happening as COVID-19 cases surge. It's hot outside, which makes wearing a mask uncomfortable. From COVID-19 to the heat, many people are worried about going to the polls. What guidance could we give them? So the guidance is, really doing the things that we know to offer your best protection, trying to keep a distance between you and your fellow voters. Hopefully many of you voted by absentee ballot, to avoid being in this situation. I know that they are taking some precautions for the poll workers, but I don't know in terms of what will be set up at the polls themselves for the voters. But if you have a mask, then please wear that. Take some hand sanitizer to have with you anytime that you feel that you might need to use it, and try to keep your distance. Take your own pen or pencil, whatever you may need, to again try to do as many things as you can to just limit your exposure in this situation. There's a question about deaths in the county from COVID-19 and for other causes. We have been reporting on deaths from COVID-19. I don't have data from other causes. That usually takes a little while to catch up. The COVID-19 we've been very attuned on, but as I mentioned before, right now we are changing our reporting system to try to keep it as accurate as possible. So we're not going to have that reported today, or maybe possibly for the next couple of days, just as that system is reported. And again, that's ADPH is in the process of transitioning that as well for that upgrade. So I don't have that information for today, and then it may be several days before we have that. Question about it in the workplace. Why doesn't your job let you know if someone in your department has been confirmed with the COVID-19 infection? So HIPAA privacy rule prohibits the release of individual health information. If you are a close contact of someone who's been infected, then you would be contacted through a case investigation through the health department. So that would be a way that you would be informed of that information, but you wouldn't necessarily know who it was that was infected. Again, protecting privacy is very important. That individual may choose to notify you themselves, but we're not allowed to give you that information. Neither is your employer, because of that person's privacy. Next question is, when can you return to work and or go to public places after you've been infected with COVID-19? You have to stay home and quarantine for 14 days and have resolution of symptoms for at least 3 days. And so that's a minimum of 14 days if you are asymptomatic. There have been people who are symptomatic for longer than 14 days, and so they would not be, if they were still symptomatic at 14 days, they would need to continue to be home and isolate. Unless they were sick enough to need to go to the hospital, obviously, then they should go to the hospital. So if you are symptom-free for at least 3 days and it's 14 days, then you can go back to work or back out in public. Another question is, I was exposed to the coronavirus at work and self-quarantined for 14 days. My test came back negative. Do I need to get tested again to make sure I'm still okay? And the answer is no, you can discontinue isolation after 14 days of asymptomatic quarantine. Just be aware that there is widespread community transmission, so you could easily be exposed again. Odds are if you were exposed but didn't ever have signs or symptoms, then you may not have been infected if you had the negative test and never had any symptoms, so you are still potentially at risk for contracting COVID-19. Okay, that is all the questions that we have for today, unless something else has come across. Anything new? Okay. All right, I think that's all that we have for today. Thank you, everyone. Please continue to do the things we know offer the best protection. 6 feet, hand washing, cover your face, your nose, your mouth, and disinfect those surfaces, and stay safe and take care of yourself and others. Thank you, everyone.